Hey there, viewers! Struggling with back pain? Back pain can be very challenging. Sometimes the only way to correct it is surgery. Before you head for any procedure, there are a few things you need to know. In today's video, we'll be discussing 7 things you should know about lower back surgery and back health. Should you wait before you go for surgery? What are good back exercises? Which exercises should you not do? Which stretches are good for you? We'll be discussing all of these and more. Number 1. Wait as long as you can before you go for surgery. This is partially true for a lot of other medical conditions and illnesses, but back pain is totally different. Surgery won't just magically relieve your back pain. It definitely helps in some cases, but it's rarely necessary. You also need to ask your doctor about the odds of your back actually getting better. Many people see their pain return. Experts advise waiting as long as you can before having spinal surgery. This wait is advised for 2 main reasons. First, as you just learned, back surgery can provide you just a bit of pain relief. Secondly, in several cases, back pain relieves itself with a few months of proper treatment, exercise, and lifestyle changes. All in all, back surgery should only be an option if other treatments have failed. The pain is severely messing up your life to the extent of disabling you through persistent pain. Have you been through back surgery before? What for? How was your experience? Share your stories with the Bestie community in the comments below. Number 2. Improving your overall health can impact the pain. Back pain affects your overall quality of life. You definitely want to treat it as soon as possible. The last thing you ever want to hear is someone ask you to make healthy lifestyle changes. You feel as if your health issue has just been swept under the carpet. But the surprising part is it's just like any other medical condition. When you focus on improving your overall health, the chronic pain gets better. It isn't just pain. It impacts so many other areas of your life. You get stressed and your sleep and physical activity are both affected. But if you take good care of yourself overall, you'll see everything improve. Start with giving up smoking. Make sure you get adequate sleep and learn stress management. Do physical activity and make healthy changes in your diet. In most cases, people see their pain decrease after all of this. Even when you consult an expert for pain management, they'll evaluate your pain in relation to your medical, surgical, and psychosocial history. Number 3. Gentle stretches before going to bed can change your life dramatically. If you've ever had back pain, you know what it's like to get up in the morning and not be able to straighten up. Does this happen to you often? Don't worry, there are a few gentle lower back stretches you can do before going to bed, and some you can do after waking up. These simple stretches relieve muscle stress in your lower back, allowing you to go about your day. You can begin with a pre-bed stretch with this simple one. Just lie on your back and bring your knees to your chest. You can also sit on a chair and pull your knee up to your chest. So simple, isn't it? There are a few other stretches you can also try. My favorite ones are lower back twists, kneeling extension, and chair stretch. Wondering how to do them? Pretty simple. Let me go over it quickly. We'll begin with lower back twists. First, lie down on the floor with your arms straight out from your sides. Knees bent, keeping your knees together, twist or lower them towards the left side of your body. Your shoulders should be on the ground. Hold the position for 30 seconds and repeat the same with the right side. 3 to 5 sets is a good number to start with. The next one is kneeling extension. I love doing this stretch as it provides relief instantly. To do this stretch, get down on all fours. Your shoulders should be over your hands. Rock forward in a way that your lower back drops towards the floor. Your shoulders should be rounded. The position would be a lot like when you're doing a cat stretch. Hold the position for a few seconds and rock backward. Now sit on your heels. Stretch your arms out in front while keeping your palms on the floor. You just completed 1 repetition of this awesome exercise. It's time to do the chair stretch. Get a sturdy chair first and sit safely on the front of it. Your feet should be shoulder width apart. Now keep your back and neck straight. As you bend forward to reach your shins, stop the moment you feel this stretch. Try to touch your heels. Don't worry if you can't right now. With time and practice, you'll be able to do so. Hold this position for 20 seconds, then slowly sit up. You just completed 1 repetition. Try to do 5 sets. If you're doing all these stretches correctly and the stiffness persists, visit a specialist. They'll prescribe you medicine to relieve the stiffness. Number 4. There can be several reasons for your back pain. Wondering what caused your back pain? Are there specific reasons behind it? Well, there are a lot of reasons why you have back pain. It can be due to an injury or a sudden jerk that hurt your back. Disc herniation is one of the most common causes of back pain. Then there's arthritis giving you back troubles. Muscular or ligament strain are also very obvious reasons why you have back pain, but infection and cancer are the most surprising causes. You need to get an appointment where your physician will evaluate your condition through a physical exam. You'll be asked to review your pain symptoms and history. Make sure you also provide your medical and surgical history. Sometimes the real reason can be very unsuspecting and associated with another health issue. MRI and CT scans are the ultimate tools to know what's happening with your back. Before we move ahead, here's a video you might like. Watch to learn more about 11 calcium-rich foods you should be eating daily. Number 5. You might need a follow-up surgery. If you haven't been able to tell by now, not everything's roses after back surgery. More surgeries might be required. In some cases, there needs to be a follow-up surgery. This is to correct mistakes that couldn't be fixed the first time. Consider one of the most common back surgeries, a laminectomy. This surgery is required to relieve the pressure on your spinal nerves in order to ease pain and weakness. To do this, surgeons will remove parts of the bone spurs, or ligaments in your back. Unfortunately, there are chances this procedure can make your spine less stable, and in case your worst fear turns out to be true, your doctor will recommend spinal fusion surgery. Number 6. You might only need a small operation. Now, this might delight you. Not all back surgeries are that complicated. There are alternatives. For instance, instead of getting spinal fusion and laminectomy, you get the 2 surgical U-shaped implants between 2 vertebrae in your lower back. This implant can serve as a dual purpose, and you won't need the follow-up spinal fusion. How? Well, the implant will keep the space between your vertebrae open, all while easing the pressure on your nerves. You won't have to deal with an unstable spine. The implant would also allow you to move your back like normal. The only problem is that it might not let you bend backwards as easily in that area. Number 7. There are good and bad back pain exercises. Yeah, you heard that right. Good back pain exercises strengthen your spine, correct your posture, and relieve the stress in your back, while the bad ones will worsen your condition. So, how do you know which exercises are good for your back and which ones are terrible? Well, let me explain quickly. Avoid toe-touching exercises. They're risky and they put more stress on the discs and ligaments of your spine. Instead, do only partial crunches as they strengthen your back and stomach muscles. Sit-ups can put a lot of pressure on the discs in your spine. Avoid them at all costs. Leg lifts can make your pain even worse. Do you have back pain? Were you doing all of these bad exercises? Let us know in the comments below. We'd love to hear from you.
Enjoyed this video? Hit like, share, and subscribe to Bestie. Wait! What kind of bestie would we be if we didn't tell you about our other awesome videos? Go ahead, choose the left or right video and enjoy.